August 19th, and begin with old business and moving to approve the minutes of August the 12th.
Move to approve.
Second.
It's been moved and seconded to approve the minutes of the August 12th meeting. All in favor say aye. Aye.
Aye.
Aye.
Motion passes. Thank you. Moving on to item number 2 under old business is the resolution for local public health employees and healthcare workers. Is anybody presenting, Kathleen? I see Dr. Melnick, but he also has an update. So
I can certainly present on this. This is just a draft resolution that was brought forward last week for consideration that we would do a resolution in honor of the local public health employees. And there was some discussion amongst the council of also adding our healthcare workers, given that they're also doing significant work in response to the pandemic. And so I drafted this based upon the model resolution, the statewide resolution that was sent around, and then also the feedback that I received from a couple of counselors. So I just took all of that feedback together and drafted the resolution here.
Rebecca, could you move it down just a little bit so we can see the entire thing?
So is this something that we would do at a Tuesday meeting, or is this something that we would consider doing at council time?
I think given the current COVID restrictions and things, it would be most appropriate to do on a Tuesday meeting. And we're certainly not under a particular time crunch that it would need to be done during a council time agenda.
Yeah, that's what I was thinking. Thanks.
So I think the questions really are, one, are we moving forward with this? And two, if so, if there's any changes that you would want to make.
I really liked how you pulled it together and integrating the healthcare workers as well as our public health officials and employees. On a technicality question, and perhaps Dr. Melnick could help with this, I want to make sure that we have our terminology correct. And I wonder, we refer in this a lot to public health officials. And I don't know if all of our public health employees are public health officials. And I would want to be sure that we're honoring all of them. And if not all are officials, if we need to change some of that language. But otherwise, I really appreciate this, Lindsay, and think that it looks really good.
I just heard about this, I think yesterday. I'm really blown away and appreciative of you for considering this. I think, I'm not sure that we call our staff officials. I'm fine with calling it, public health workers, public health staff, public health employees. Yeah, the officials are more like the health officer, and I guess that would connote that. I would. I didn't put this together, so I don't know where it particularly came from, but I'd support making it more inclusive of those who work in public health.
The terminology of the public health officials came from that statewide resolution, and I struggled with that a little bit too. And I think it'd be definitely easy within the draft to change it to public health staff, public health workers, something like that.
I'd support something like that. And yeah, since the state one was referencing public health officials across the state, and we're trying to here focus on our folks in the county who are doing good work, I would be supportive of your, on making the best choice for what makes the most sense to make sure that we're referencing employees or staff here. I'm not going to be picky about that word. So.
Yeah, I think that would be meaningful for for all the folks who work in public health. I agree.
Yeah, that's easy. I can make that change.
Okay, thank you, Lindsay. Were there other comments of the council? Councilor Olson, did you have?
Yeah, I just in terms of employees, staff, or workers. I kind of like the word workers for some reason. I don't know why.
Yeah, that's what I plan on changing it just to workers. Then you have the consistency with the healthcare workers as well.
Because we have some that aren't employees, they're contract Well, I guess it'd be contract employee. At any rate, workers, I think is good too. Okay, sounds like we have consensus on that, and we'll move forward with this on our next hearing.
Yep, we can
Okay.
schedule it for September 1st.
All right, okay. Thank you. Thank you, Lindsay.
Great, thank you.
Okay, moving on to item number 3 under old business, COVID-19 update. Dr. Melnick.
Dr. Melnick, please unmute yourself.
Here I am spacing out on the mute thing there. Thank you, Council Chair Quiring. I have a real brief update. The good news is that case counts aren't going up. The bad news is that they've kind of plateaued at a fairly high rate. We're averaging over the last couple of weeks about 28 cases per day. We need to be below 9 to be at that 25 per 100,000, that lower activity level. A week ago, we were at 88. This week, we're at 74.7, and 75 per 100,000 is the borderline between moderate and high. So we're running, high, moderate to high level of activity. The good news is that one of the concerns I've had, with the surge in younger people earlier on, that as it moves into older populations, we'll be seeing more hospitalizations and deaths. But hospitalizations, fortunately, remain pretty flat with about, you want to have 10% or less of the beds occupied by COVID-19 patients. We've been running about 3 to 4%. We've been continuing to work with our school partners. In fact, my deputy health officer is on a call with the ESD 112 superintendents, all the superintendents right now. We had some discussions with them about school opening plans. We all agreed, all the superintendents agreed that besides following the state guidance and considering Clark County a high level right now, we felt and they felt that we really needed to have 3 weeks of sustained moderate or below levels before opening up. And one of the superintendents, and they all agreed to this, felt more comfortable giving it 3 weeks beyond Labor Day, because there's a lot of concerns that another holiday could result in another surge, kind of like what we saw after, the time around July 4th. So 3 weeks of sustained moderate or lower activity after that, the superintendents felt comfortable with, the gradual reopening if we maintain that level. And that would probably end up being like the first or second week of October. And I'll keep, as those discussions continue, I'll keep the council and the Board of Health up to speed on what's going on there. With the Labor Day holiday, I was reminded that we have yet another holiday coming up that really a plea for folks to wear face coverings, maintain physical distancing, avoid gatherings, and practice good hygiene. The only other update I say is that, yesterday we had 26 new cases, no deaths. So far in Clark County, we've had a little bit over we've had 2,325 cases and 45 deaths. And as I mentioned earlier, right now we have 4.1% of beds occupied by COVID-19 cases, and we have a lot of hospital capacity. We've got 56.7% of beds occupied in general, and right now 19 cases hospitalized, which is kind of flat where we've been running all along. So that's my update for today.
Madam Chair.
Yes, Council Blum.
Dr. Melnick, I got a call last week from a private school. I'm not sure if it was principal or superintendent, and they were wondering if there'd be any possibility of doing some kind of call similar to what is happening right now with the public school superintendents. They could arrange a time either with you or with your deputy to do that. Is that something we could get scheduled so all the private schools can come together and hear some of these same information and updates?
Yeah, Councilor Blum, if we get a few of them together at one time, that might make it easier. But yeah, Dr. Krager and I have done some calls. We even did some specific calls with the Green Mountain School District superintendent because there were some particular issues that he wanted to discuss with us. So yeah, we can arrange that. I know we had provided some information to Tricia Roscoe, who's working with the I don't know if it's an organization of Catholic schools in the area, but yeah, we could meet. We'd be happy to, do have conversation with them, just like we've done for the ESD, superintendents in the public schools. I think we can arrange that.
Great, thank you.
I had a question about the schools and the age group of students, for instance, that are not quite as susceptible to COVID. Has there been any discussion about that? And is not opening the schools more protection for the instructors or the children? Can you help me understand that?
Yeah, that's a great question, Council Chair Quiring. So that when we do open up and we get to the moderate range, the first group that will be brought in will be K through 5, according to the state guidance. And it is true that children, while they're not immune to COVID-19, and they're, some kids young children have suffered complications. The issue with children when we're at a high rate of community transmission like we are right now is that by bringing them back too early, it's not just the staff that are at risk, but it's also you have children in a congregate setting like that with high levels of activity, that children get infected and then they bring it home to their parents and their grandparents as well. So it's an issue around community transmission, and the evidence suggests that bringing the kids in too early would actually contribute to community transmission, including putting older people at risk as well.
Okay, understood. I mean, I understand they can bring it home. And so I guess the other thing that I think about and have heard talk about is this herd immunity thing. I mean, how are we ever going to get past this if we don't build some sort of immunity? And do you have any comment on that, how we might do that?
Great question. We're a long way from herd immunity, and the articles I've read, I mean, there have been estimations. COVID-19 isn't as contagious as measles, for example, where you need about 95% of the population immune. With COVID-19, it's estimated you need about 60 to 70% or above. And we're really, even with the surveillance studies that have been done, we're way, way, way below that. And the way to develop herd immunity is through not only developing an effective vaccine, but implementing it and getting people vaccinated. And we're a ways away. Unfortunately, we're a ways away from that, and we'll be living with this for the foreseeable future. But it's not herd immunity. But if we got 95% of people wearing masks, it would have basically the same effect, that we could get the numbers way down. But at least 80%, 80 to 95% of people wearing masks would be helpful, but we're unfortunately a long way from herd immunity. And, the other problem with herd immunity is, and I'm going to go on, I guess I can go on and on about this. We don't even know whether natural infection with COVID-19 makes you immune. It's possible. I'm not saying it can happen. I said it's a possibility. And so we're learning more about this disease, that we don't know whether people can get reinfected with it. We know that people can get reinfected with other varieties of coronavirus that cause common cold, but we don't know about this yet. But the bottom line is we're a long way away from herd immunity, unfortunately.
Okay, thank you.
I'm sorry to be gloom and doom.
I know. Yeah, this is, yeah. Okay.
I'm worried about the flu season also. And
right.
We're talking, I would really urge people to get the flu shots when it becomes available.
Okay. Okay. Are there any other questions of the council on this section? Thank you so much, Dr. Melnick. And I guess we'll see you at our next, whenever, and certainly at our next Board of Health meeting, but whenever you want to join us.
Thank you.
You're welcome. Okay, moving on to new business, the interlocal agreement with the Cowlitz tribe. Emily? Need to unmute, Emily, can't hear you.
Sorry. Good morning. I apologize for that. I believe the Undersheriff John Chapman is on the call as well. So I'll give a brief introduction and then let him explain some of the details. Just to give you a little bit of background, a little over, I believe it was about a year ago, the Cowlitz Indian tribe approached the sheriff's office about forming a tribal police force, which they already have a tribal police group on their reservation at Elan, but they wanted to be considered general peace officers. And there is an RCW, it's under Chapter 10.92, that provides for, it's called the Tribal Police Officers Act. And as I described in the staff report, it allows a recognized federal Indian tribe in the state of Washington to apply to be a tribal law enforcement officer to act as general authority Washington peace officers. So in order to do that, the tribe needs to enter into an interlocal agreement with the jurisdiction where, in fact, the tribe reservation is located. So for here, the Cowlitz Indian tribe is located in Clark County. And so the tribe approached the sheriff's office about entering into an interlocal agreement. And over the last year, the sheriff's office, as well as the prosecuting attorney's office, worked on had some back and forth on creating an interlocal agreement to address some issues that are needed to be addressed per the RCW. And before you today is an agreement that was reviewed by the sheriff's office, as well as the prosecuting attorney's office and myself, and worked out with the Cowlitz Indian tribe to come up with some specific protocols. And I will let the undersheriff sort of describe some of the details with that. I did also just want to mention that the Cowlitz Indian Tribe Council did in fact pass a resolution already approving this interlocal agreement. So that's why it's before you today.
Good morning. I just want to, a little bit would be that the way the RCW reads, excuse me, would be that it is an agreement that we need to make. We're not against it at all, but we're not endorsing it. And what this allows is the Cowlitz tribe to be commissioned, not under the sheriff's office, but through the state. And so we're very supportive of that plan. The Cowlitz tribal police members will each be certified by the CJC and we'll get a state certification. And so it benefits us in the same way that as the city of Battle Ground has a jurisdiction only within their city limits, this would allow similarly the tribal police to be able to conduct law enforcement outside of their reservation. And, you know, right now what happens if they follow somebody off the reservation and need to take some kind of a police action, the sheriff's office is called, come take over for that. And so I think this reduces liability for the sheriff's office, and we're certainly for this.
Right, so I could just add a couple things before.
Okay.
Under the RCW, as the undersheriff mentioned, there is a requirement to enter into this agreement if the tribe has followed through with the requirements under state law. So that includes having the Criminal Justice Training Commission certify that the officers have gone through the training. They also have to certify that they have sufficient liability insurance to cover any potential civil claims. So there are some parameters that must be met by the state. The state has to certify that before they are in fact general peace officers. So really the important piece with Clark County is to work out sort of the details of how this shared jurisdiction might work and to coordinate other issues like referrals to the prosecuting attorney's office.
Okay, are there questions of the council? I just want to comment myself that I had gotten some information from individuals that there may be some problems or that we should be cautious, I guess, about this. And through that comment, I did speak with the undersheriff and asked about a couple of things, one of which was to see the use of force policies, rules, procedures that the tribe has. And having seen that, they basically mirror what Clark County has. And so thank you, John, for getting that for me. And I think it was sent to the rest of the council, but that was one of the concerns. And, you know, if the RCWs require us to do this, and as you say, we are not deputizing them, correct? The county is not. They have to receive this training, et cetera. And as I understand it, they don't go to the state academy. They go to a federal one. Is that right, John?
That's correct. They have the ability to go to, it's called FLETC, the Federal Law Enforcement Training Center, and I believe it's in the southeast portion of the United States. Then they would come to the state of Washington and essentially be like a lateral police officer from another state, and they would go to the equivalency academy that CJTC puts on and give them full general authority here. So you're correct that the sheriff does not swear them in, does not commission them any way. It's all done through the state, and which is a better process. And I think the ability that they have to go to a federal law enforcement training center benefits us also because it doesn't put them in competition with us in trying to get our people in the academy.
That was my concern originally, because we've heard about that over and over again, about the spots and the slots that we need to take. And so I appreciate that information. Are there other questions or discussion of the council? I don't see any. And we are being asked now, Emily, to approve this. Is that right?
Yes, if you could have a motion to approve the agreement and delegate authority to the county manager to sign the agreement, that would be the preferred option.
Okay, I would entertain a motion then from a council member, if you would.
Madam Chair, I'd move to approve the interlocal agreement and authorize the county manager to sign the documents to follow.
Okay.
Second.
It's been moved and seconded to approve the interlocal agreement with Cowlitz Tribe and allow the county manager to sign the agreement. Is there further discussion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Opposed? Motion passes. Thank you. Thank you, Undersheriff John Chapman.
Thank you.
Thank you, council. If I may, I have one other matter I just wanted to bring to the council's attention regarding the Cowlitz Indian Tribe. This has to do with the Education and Arts Fund. Under the tribal ordinance that was passed by the tribe, essentially after A was approved by the State Gambling Commission and they entered into a compact with the state of Washington, there were a number of requirements that the state had for the tribe in order to build the casino on the reservation. And that compact led to the ordinance. The ordinance went a bit further than the compact required and included in it that certain amount of proceeds from the casino would be sent to essentially this, what they called at that time, I believe it's the Cowlitz Tribe Education and Arts Fund, but let me get the wording exactly right. I don't want to misstate the name of it, but it's in their tribal ordinance as, get to the right print. Yes, the Education and Arts Fund, with the idea of supporting charitable activities in Clark County. And under that fund, it's managed by a 5-person board, which has 2 tribal appointees, 2 appointees from Clark County, and then a 5th member is chosen by the 4 members of the board. And my understanding is that I believe it's Counselor Lentz and Chair Quiring that currently serve on that board. And I was asked by I believe it's her name is Carissa Lowe. I believe she runs the Education and Arts Fund. And they had a request to essentially seek the informal approval of the council to make a change to the tribal ordinance so that it's called the Clark County Fund, and it's broader than just arts education and local government support, that it is essentially a charitable activities support so that they have more flexibility in what they can award through this fund. And they're making changes in their bylaws and their charter to sort of reflect those changes. I did review the ordinance. I reviewed the state gaming compact to make sure there was no conflicts with that, which there is not. And I also reviewed the bylaws and charter for this fund. And I didn't see any concerns with it, but I wanted to bring this to the council's attention because, again, the tribe requested that there sort of be this informal, yeah, this sounds okay with us, even though formally the council doesn't have to approve this change to the tribal ordinance. I don't know if there were any questions or thoughts about that.
Are there questions of the council? Okay. Any comments?
I'm just curious if you guys sit on the board there. Do you have any other feedback or insights? I mean, it makes sense to me, but if you have any other thoughts.
It makes perfect sense to me, and we have discussed this on the board or as the board, and it gives a little bit more flexibility. For instance, the tribe really honors its veterans and veterans in general, and so that sort of thing, being using some of the funds, for instance, for that kind of thing. And there are cultural educational things. Of course, that would fall under education. But I think it's really consistent with what we would want to do as a county and certainly the tribe. So it is the tribe's, those are their funds, but they want to give back to the community. So I would say, I don't know, Councilor Lentz, if you have any other comments about it.
Largely echoing that. As we've served on this committee, we've seen a number of different types of requests come in. And while there is a concerted effort to support arts and education, and that certainly isn't going to go away as a part of this, the committee is recognizing that there's a lot of need and in other areas, and that the tribe itself does have additional giving priorities and support priorities, including veteran support, social services, that sort of thing. So this increases the ability to do more good throughout the community, and I think it's a good choice.
With that, Councilor Olson, does that answer your question or your comment?
Yeah, I think you just add some context to the conversation.
Yes,
it made sense to me.
Right.
If you need
Okay.
some sort of informal, yeah, I'm all for it.
Okay, maybe shall we do a motion, Emily? That's the best way to do it, I think.
Yes, you can.
Okay, so I would entertain a motion then.
Move to approve the name change from Education and Arts to Clark County Fund.
Second.
It's been moved and seconded to change the name of the the Cowlitz Tribe Arts and Education Fund to the Clark County Fund. Any further discussion? All in favor say aye. Aye.
Aye.
Motion passes. Thank you. Thank you, Emily. For your,
Thank you. That's all for me. Thank you.
all right. Thank you. The next item, adjunct services.
Yes, good morning, counselors.
Good morning.
For the past several years, I've been an adjunct instructor at a couple of colleges here locally. More recently, through Clark College, I've been teaching human resources management in their Bachelor of Science and Management program. The next class is scheduled the end of September. Normally, it's a 5-week class where it's one night a week with online work in between. This year, due to COVID, it will be strictly online. Per the employment agreement, it states that the county manager shall not spend time working, speaking, consulting, or providing other services in non-county connected business for which compensation is paid without the express prior written consent of the county. So I am asking the council for consideration to allow me to continue with this specific class in September. There will be no impact to my work with the county, and there's no conflict of interest.
Okay, is there discussion by the council? I certainly agree that she should be able to do this.
I agree as well.
Me too.
Okay.
Yeah, my only question would be, we have to provide something to you in writing at some point then.
I believe if you would do a motion today, the written approval could be in the minutes.
I'd entertain a motion then.
Move to approve the county interim county manager serving as an adjunct at Clark College for this term.
It's been moved and seconded to allow the interim county manager to serve as adjunct instructor at Clark College. Any discussion? All in favor say aye, please. Aye.
Right.
Aye.
Motion passes. Thank you.
Thank you.
You're welcome. Okay, do we have anything under work session? Or?
No work
No.
session request.
And Lindsay, did you have anything to report?
I do not. Nope.
Okay, then we will go to an executive session for pending litigation for 15.
Madam Chair?
Yeah, oh, I'm sorry.
Do we have council reports?
Oh, I'm sorry. Did I? Yeah, oh, sorry. Completely missed that. Council reports. Did you have one, Councilor Olson?
I do, but I was going to wait to see if anybody else had one.
Go ahead.
Okay. I forwarded you an email that we received from Mark Mathias on August 13th. And I'm not asking for any action this morning. I just wanted to kind of have some basic discussion around this particular letter and his request. And I think, John, you've been attending these Thursday calls, and you may have some additional background, but what he's looking for and what the Restaurant Association and Hospitality Association is looking for is some support to petition the state for some changes in some of the guidelines for restaurants. And so I don't know, John, if you've got any additional background, but I don't think this letter's in its final form. So I just wanted to let you know that. I've been having discussions with him a little bit about the form of the letter. But I just wanted to open it up for general. He's going to be looking for us for some sort of support to, like I said, go to the state public health officer in the governor's office. I believe he has support of all of the city mayors in Clark County. So I just wanted to make you aware of it and I guess get general thoughts from you today, and then we can talk about it maybe again when he has a more formalized or final letter. So John, maybe you have some additional thoughts.
Yeah, I think what he's looking for is just some small changes to some of the restrictions that the governor has put out. Things like if people are back to back, can that be a 4-foot distance instead of a 6-foot, with the thought being you're not potentially spreading the virus from someone behind you, it's coming forward. So some things, a few other adjustments like that. So I would say it would be great to hear from Dr. Melnick. I think we have Board of Health next week for our regular meeting. So if Dr. Melnick had the opportunity to review and just verify that, yeah, these all make sense, they do to me, and I think that's why under the mayors as well. So it'd be great to hear from Dr. Melnick next week if you can review the letter and say, yeah, I would support signing on to this, and then looking at what a plan looks like going forward, working with the State Hospitality Association, WASAC, and other groups to try and get some relief for the restaurant owners.
And I see Dr. Melnick is with us now too. I read the letter and I think it came directly from Mark Mathias. It wasn't forwarded. At any rate, I read the letter and responded to him and sent the letter on to Dr. Melnick and Kathleen, our county manager. And to me, the letter is compelling. The things they're asking for are sensible things, and it makes a lot of sense. But knowing that our county cannot really do anything different than our state does, it would be great if we as a council would, and Board of Health would really plead with our health officer, our public health officer, Dr. Melnick, are you not still president of WASELFO? And if he is, maybe talk with them too, and Dr. Wiseman at the state, and therefore the governor as well. To me, I feel such angst, I guess would be one of the words, for our restaurant owners who are really struggling. Some who have collapsed and closed, and I think it's a real shame. So. Because we have other stores, we have other facilities that are open. It just seems like really they're sensible changes that I think will still maintain safety. So Dr. Melnick, I don't know.
Yeah,
Go ahead, Councilor Olson.
Put Dr. Melnick on the spot today. So he and I met last night also and talked through the letter, and that's why I don't think it's in its final format. It's based on some of the feedback that he provided. Mark might be able to make some edits, and one of the key things that we can agree on is, how can we treat restaurants similarly to other industries and try to get some consistency where there might be some more flexibility for restaurants. So, but I can touch base with you guys this week about my conversation with Dr. Melnick and trying to get this letter into a place that hopefully we can support and move forward with.
And I do not intend really to place Dr. Melnick under any kind of hot seat here. I just think this is a conversation that, getting the feelings of the council, you hear what we're saying. That's all. I'm not putting you on the spot. So.
And I wasn't accusing you of that. I just wanted to make sure he didn't feel compelled that he had to answer anything this morning.
Okay. All right. Thanks. Okay. I guess this is something that we can talk about perhaps at the Board of Health, and if we have a different or more a different letter with different points, we'll wait for that. But
Madam Chair.
Yes, Councilor Blum.
Sorry, and just one more point on this. I think a lot of this is also not just about now, but looking forward into fall and winter, and that there's things that can be done right now with outdoor seating that can't be done in late October, early November. So trying to get ahead of that and not waiting until that outdoor seating option goes away to have perhaps some changes to the code, I think is why it's important to kind of get a jump on this now. So I just want to say it's not just about now, but it's also about fall and winter when outdoor seating just doesn't work.
Right. Very good point. Any other comments on this subject?
I'll just keep everyone posted when I get an update.
Okay, thanks. Okay, other councilor reports? Okay, I don't see any. We log out to go back into the executive session, correct? Yeah. Okay, we'll adjourn this meeting.
There
I'm
will
sorry.
be action. There, I just want to clarify, there is potential action after executive session.
All right. Okay. We'll go into executive session then for 15 minutes for pending litigation with possible action afterward. So we'll adjourn this meeting. I will see you on the other side.